Hi again. Another potential problem that can happen is we can break a denture. So if we've got a denture, either a partial denture, so one that's replacing a few teeth, or a full denture, one that replaces all of the teeth in a jaw, and it breaks. So we dropped it in the sink when we were cleaning it, it's dropped on the floor, or something bad has happened. It's meant that we've now got our denture in two or more pieces. First of all, don't panic. Even after all of this horrible period has passed, the dentist, your dentist, should still be able to get that fixed at the lab. It's a relatively straightforward procedure as long as you've got all the bits. So if you can't feel that you can do this yourself, keep all the bits in a bag, in a safe place, somewhere it's not going to get binned or misplaced, and hang on to that until all of this has passed and you can get to visit your dentist. If you're comfortable, however, looking to do this by yourself, well, super glue is the way forward. Now, as we all know, super glue sticks to a lot of things. So it's important to make sure, first of all, that the denture accurately locates together. So if you can get that denture to accurately locate together, then that's great. It should be a fairly simple case of tracing with a small amount of the glue. But remember, if we get too much there, it's going to displace either into the tongue side or worse, onto the fitting surface of the denture. If it displaces onto the fitting surface of the denture, it won't fit anymore. You'll have a ridge of super glue which is going to dig in and be uncomfortable to the soft tissues that it's going to sit against. So small amount. If you're a little worried about that, use a cocktail stick or similar, something with a nice sort of edge to it. So as you put the super glue against the surface, you can then trace with the cocktail stick, and that just evens it out and makes you sure you've not got too much, but obviously have got enough in place. Hold the two edges together and make sure you hold it there for plenty of time. Again, check whichever super glue you're using for the setting times on that. And at the end of that, you should have at least a temporary fix. Now, that's not going to last forever, but it will certainly get you through a tricky period. My advice to you, if you've had to do that, is maybe use a little bit of denture adhesive whilst you're using the denture, because it's going to just take a little bit of the impact load out of that, and it's the impact load that's likely to break the glue that you've just spent all of that time using to repair your denture. So put a little bit of denture adhesive on that. It'll just ease the impact load until, again, you can get to your dentist to get it fixed definitively. Hope that helps.